I want to show you a case that spanned several years, and it's really a great case to show in terms of highlighting the difference between skeletal expansion, which uses something called a palatal expander or a fixed palatal expander, also known as a Hyrax expander, versus dental expansion. Now, this patient is very familiar to me because she happens to be the daughter of my very best dental assistant. So I have kind of a really tight knowledge of this case. So when she came in, she had crowding. You can see the crowding. Yes, there's a space, but you can see how this tooth doesn't have room to come in. This tooth doesn't have room to come in. You can see the lower teeth have some displacement, and there's not enough room for the lower canines. Now, back in the day, we used to extract teeth, and I mean back in like the 1980s and 1990s, the latter, which is when I started my orthodontic career. But I treated actually this patient's mom when she was first an assistant in my office, probably about 20 years ago, and she has a full, beautiful smile. That's the modern approach. So in this case, if this case came into a lot of offices like you see on the left, and the patient was about 7, 8, or 9 years old, very frequently what will be prescribed would be a fixed palatal expander, the device with the key that the parents turn. I have placed, I guess, thousands of them, and they work. But here's the point I want to drive home. This patient had no crossbite on either side, meaning the transverse occlusion was normal. If you look at the upper arch, and I don't you don't see the palate here, but this is not a narrow arch. Now, that doesn't mean you could not use a palatal expander, the fixed kind, but it's a very robust skeletal expansion that really is not needed here. And I can tell you it's not needed because I'm going to show you the after in this case. So basically, the dental expansion can be very fruitful in these cases, and you can treat the top and the bottom together. And so the initial plan was to broaden the arch, as you see here. This is broadening the arc in terms of the teeth, and that is okay. And then when the patient finished this, they wore a retainer. Then in phase 2, the patient actually preferred braces. I can actually show you an intermediary point, let's see, of how things looked. And this was way back in 2021 when we used the Invisalign appliance to do dental expansion. Here you go. So look at how beautiful. The middle is how the patient started, and here's how she looked at the end of that expansion. And the occlusion was okay on the sides. And basically, we then, after the patient wore retainers and we waited for eruption of the teeth, the patient wanted braces. I guess we couldn't fight her desire to have pretty colors and be like a lot of the 8th and 9th grade girls. But I used braces for, I think, 6 months. And now here's how she is now. Now I still have an occlusion that needs improvement, and I'm going to probably make a few more aligners to tighten this up. So I had a minimum time with braces, which definitely are a threat for ideal oral hygiene. But this is a full, beautiful smile. And the bottom line is it did not need a skeletal jaw expander. It benefited from dental expansion with Invisalign First, a system of trays. Kids do very well with them. They like wearing them. Teenagers do well with Invisalign too, but I would definitely say the segment of the population in the 7, 8, 9-year-old category, they like their aligners and they follow the rules. So I hope this helps.